Health Diagnostic Laboratory, Inc.
Welcome back to the broadcast. I'm here with Dr. Tara Dahl with Health Diagnostic Laboratories. We're doing something a little bit different with our segment today. We've brought some folks in who've had testing done and have some questions about their results. And this is a way to sort of show the viewers and share with them the kind of information that they get from advanced testing and how important it is.
Absolutely. And it's great that everybody here has experienced what it's like to have this test and what it feels like to get a few reds back and want to know what that's all about. So we're here to answer all those questions for
everyone. This is, by the way, a normal blood test, as in they take your blood in the normal fashion. It's just that the markers that they read are so much more detailed. And okay, so we have a question from
Chris.
Chris. Okay, Chris, hold that microphone up. What's your question?
Hey, Dr. Dahl. Actually, I want to ask for my wife. We're recently pregnant, going to have a little boy. So
I love that you said we. Good for you.
I saw y'all's segment earlier.
Yeah.
Her labs look great. She had literally greens across the board. She's very healthy, but get to the genetics portion, and she has the MTHFR polymorphism. So she comes to me freaking out because she noticed that folic acid for her might cause, some instances of some pregnancy complications. So I just wanted to ask you a little more for explanation of folic acid being bad for a person that has that MTHFR, or any clarification you could add for that.
And no one would ever know that.
No, absolutely not. This is actually an excellent question because women typically are given folic acid during pregnancy to prevent neural tube defects. And we just do that by default. We just give everybody folic acid.
We're all given it.
We're all given it.
I mean, I was pregnant 4 times.
Absolutely. Every time you get it.
Yeah.
The thing is, if you have an MTHFR mutation, your body isn't able to methylate folate well. And so actually, what we should be giving women who have an MTHFR mutation is a different type of folic acid. So instead of regular folic acid, she would need methylated folate. Now, there are prenatal vitamins that contain the L-methylated formulation of folic acid, and that's what she should be on. So she needs to make sure that she's talking to her doctor about getting a special type of prenatal vitamin that has the methylated folate. Now, if she had a severe mutation, like a homozygous mutation, the double mutation, certainly there is some increased risk for clotting, and sometimes we even see miscarriages with MTHFR mutations. So, but as long as you're addressing that with the methylated folate, I mean, that should be a very, safe, healthy pregnancy.
Now, I have a question. Did her OBGYN do the test that found out she had the mutation?
Yes, actually, it's interesting. She's an RN in an OB-GYN clinic. So when she noticed that, it really started changing the way that she talks to her patients. But when she first found out a while back, she just literally came to me in tears, thinking, "Oh my goodness, there's."
Yeah.
Well, this is a fixable problem.
Exactly.
So
and
this is something where you're empowered versus depressed about this.
Is this something you can
really
ask
important.
your OBGYN for, this blood test?
I think people should. In fact, I think we should really be talking to OBGYNs much more often because they take care of women, and a lot of women don't go anywhere else but an OBGYN. And something like the MTHFR, prothrombin factor 5, these are all things that we check for on the Health Diagnostic Lab report, and all very important information for women, especially women who may become pregnant or may be contemplating hormone use, because those different mutations may affect the way we make choices about that.
Not to mention diabetes markers, heart disease markers, all of which you wouldn't know about, and then you go through this pregnancy, which is taxing on your body, by the way.
Absolutely.
and you might have all these other factors going on in your body that you don't know about.
Right, and actually during pregnancy, typically as you get further through pregnancy into the 3rd trimester, we tend to become somewhat insulin resistant. Just naturally, that really happens in a normal pregnancy. But if you had insulin resistance at the beginning because of your genetic makeup, that's something you'd want to be aware of, because those patients are going to be at higher risk for gestational diabetes. And if we can keep a closer eye on that, hopefully be able to avoid that from coming on. So really, I think very helpful for women to get this even before they become pregnant, to really understand what their baseline risk is. But early in pregnancy, we can detect all of these things, and it can be very helpful.
So smart. Again, it's one simple request to your OBGYN. I'd like to have the advanced testing done. The doctor then contacts Health Diagnostic Labs, puts the order in for the testing.
Right.
You go over there, get your blood test done. Covered by insurance?
Yes, it's generally covered by insurance. Most of the tests that we do, there's the few that are not, typically that's not something that's passed down to the patient, so there shouldn't be any significant out-of-pocket cost to a patient.
So we have no excuse
Right.
not to know more about the state of your health. Do we have another question?
Hi, Dr. Dahl.
Hi,
So in talking to the doctors, every day I go out and I talk to doctors about this, and one question...
Boomer works for Health Diagnostic Laboratory, by the way.
Full disclosure,
He's
I know
not
Dr.
just randomly
Dahl.
talking to doctors because he's so excited about the testing.
You never know. Well, one question I keep getting is around sterol and stanol absorption markers, and sometimes they'll fluctuate. They'll be in the hypo range. Sometimes they go up into the red, the hyper range. And quite honestly, the question is, what do I do about this? What do I do about it first, but then what do I do about it if I see it change in 3 months?
Okay, so the question is about sterols. Now, I think we've talked on one of our shows about
Cholesterol.
sterols, but it's basically tells us whether or not your body is absorbing sterols through our gut or whether the body is sort of overproducing it in our liver. And so we have this panel that basically detects, are you somebody that's overabsorbing? We call you a hyperabsorber. So if you're advanced testing particles, those bad particles that we carry, if they're high, they could be high because your body is overabsorbing in your gut.
Sterols, but
The sterols,
like cholesterol,
right.
like from the food
like
you eat? Or?
It's from the food we eat. It's not cholesterol, but it's a sterol, plant sterol.
Okay.
So we can either have elevations from that, or we can get elevations because our body is just overproducing sterols in our liver.
Mm-hmm.
And so depending on what that test shows, that will actually affect how I decide I'm going to address the patient as far as treating that risk. So for example, if a person is a hyperabsorber, they will not be able to, they probably won't respond very well to a statin, because what a statin does is it stops production in the liver, but that's not your problem. The problem was actually happening at the level of the gut, so it can be extremely helpful. Depending on what people's diet is and what supplements they're taking, they could have some switching back and forth with the sterols, maybe abnormal one time and then, turn back normal again. So we do a little bit of digging to try to sort that out.
This is the great thing also about Health Diagnostic Laboratories, is you have a very educated staff who goes through the report with you as a client and really kind of explains everything and gives ideas about how you can change your lifestyle, your diet, things like that, supplements you can take.
Absolutely.
To get it under control without so much medication.
Okay.
All right, Dr. Tara Dahl, thank you so much. If you would like more information about Health Diagnostic Laboratories, you can just check out the information there on your screen, or you can go to thebroadcasttv.com. We have all of their information and these segments again if you'd like to watch them. More broadcast when we come back.